Hi, I'm Eric Vanderwall from Gut Well Now. I'm going to give you my 10-second introduction. I completed my Doctor of TCM program, acupuncture, and Chinese herbal program in Canada, where I'm originally from. I also hold a master's degree in medicine, and I'm a trained shiatsu therapist. Now, today we're going to be talking about the 10 mistakes you're making in self-treatment. While I was writing this, I was certainly thinking about SIBO, small intestine bacterial overgrowth, in my mind. However, this certainly does apply to all gastrointestinal disorders, and probably even beyond that. So that being said, let's just jump right in. One last thing, our little disclaimer, this talk and handouts contain general information about medical conditions and treatments. This information is not advice and should not be treated as such. If you think you may be suffering from any medical condition, you should seek out medical attention immediately. So let's talk about some of these mistakes. So the first step in correcting a mistake is knowing what that mistake is. A mistake can both be costly and time-consuming for us as patients, and throughout the years, I've been able to help many people who spent a significant amount of time trying to self-treat. So my question to you is, are you one of these people? And here's a list of some of the most common mistakes that people make in self-treatment. Also want to tack on into this is if you're being treated by a healthcare professional, that's great. You may also want to go through this because it's going to help you ask the right questions to your healthcare professional and help you dodge a few of those bullets along the way. The number one mistake I often see, not number one because it's always the first mistake, but one of the most common mistakes is following a protocol on the internet without first understanding why. Again, this is probably the most common mistake I see in patients who are self-treating. They find a protocol on the internet that was used by another healthcare professional or perhaps not a professional, and then they apply it to themselves. So unfortunately, results are often very lackluster, and they're further disheartened because the protocol does not work. In reality, the protocol often does work, but it's not the correct protocol for that person. It wasn't applied correctly, or it wasn't implemented in the context of a whole healing or whole treatment program. When you don't understand the underlying mechanisms for a protocol, it's almost impossible to know if it's going to work for your particular condition, disorder, or presentation. The second common mistake I see is treatment without proper diagnosis. So treatment without a proper diagnosis is at best a shot in the dark. So this falls along with our point number one. It's next to impossible to choose an appropriate treatment protocol without knowing exactly what's happening in your body. A correct diagnosis often includes an extensive history, your signs and symptoms, lab testing, and other examinations, along with some amount of trial and error to suss out exactly what's happening. Mistake number 3, thinking protocol medicine is medicine. So protocol medicine certainly has its place in medicine overall. However, one of the reasons why naturopathic doctors, functional medicine doctors, osteopaths, Chinese medicine practitioners are so successful where many other traditional MDs have failed, and not all traditional MDs, is because they go beyond protocol-driven medicine and treat the individual. Tried and tested protocols should be incorporated into an overall healing program, but without missing the individual's signs and symptoms that make them an individual. So it's easy to be overwhelmed by all the large number of herbs and supplements and vitamins that are used to treat just a single disorder, and yet each one of these things has a very specific purpose and should be applied with care. Mistake number 4, relying on a single lab test or symptom for choosing the course of treatment. So no single lab test or symptom can give us a full picture of the unique dynamic of a person and their underlying condition. And it's that complete picture that's so essential in creating a treatment program, which really brings us to point number 5. Mistake number 5 is focusing on curing one symptom instead of trying to improve overall wellness. So it's very easy to get tunnel vision sometimes when using a single lab test or focusing on just a single symptom. We hope, we pray, and we long for that one horrible symptom to just get better and go away. But sometimes we need to take a step back and understand that the single symptom is just the tip of the iceberg poking above the surface. So even if we shave off that tip, another one is just as likely to form. So we see this in a lot of patients who think they've successfully treated themselves, they've maybe eliminated their SIBO, and a few weeks later, 1 month later, it all just comes crashing back. They really haven't gotten to treating the underlying condition and treating their overall wellness and we're just focusing on one symptom or sign. So the body is an incredibly interconnected entity where one imbalance builds up in one area and then can manifest in another. Common mistake number 6, not changing the course of treatment after retesting. So if lab work is determined to be an important part of the diagnosis of your illness or the patient's illness, then it's a mistake not to course correct after retesting. Lab work, whether it's improved, not improved, positive, false, gives us some information. This is valuable information. We should make this information work for us. Again, this brings us directly to point number 7. Common mistake number 7 is taking pharmaceutical grade herbs for too long. Herbs, be it Chinese herbs, Western herbs, can be extremely potent, especially when these are pharmaceutical grade. We're not talking about necessarily, something you picked up in the grocery store, and they can be as potent as antibiotics. In fact, they often have a much more wide spectrum of effect on the body, as they're made up of more broad range of active compounds. The long-term use of antimicrobial herbs are rarely, if ever, prescribed by trained professionals. If they are, one should very critically question why and look into the possible ramifications of such actions. So again, talk to your healthcare provider about this if you are under the treatment of one. So herbs should be taken with a specific goal in mind, and when that goal is reached, herbs should be discontinued or changed. If the goal has not been reached, then a new approach may need to be taken. I'm often asked, how long should I take these herbs? Unfortunately, this is a question that needs to be answered on a patient-to-patient basis. So we don't prescribe the same herbs and the same dosage and the same length of time to do two different people. Maybe one's 140 pounds, one's 200 pounds. One has liver damage, one has a very good liver function. Maybe one has good immune function, the other one has perfectly great immune function. Maybe one has a history of Tylenol usage every day, and the other one doesn't have any supplement history at all. So we really need to take these things into account when we're prescribing herbs, or whenever you're just taking herbs by yourself, and considering dosage and how long and things like this. It's not really that straightforward. Common mistake number 8, not understanding the ramifications of clearing away pathogenic factors. So as long as the patient's vital energy, their so-called overall body condition, is fairly strong, typically the first act of a complete wellness program is clearing away pathogenic factors. This is done so that real healing can take place. But like washing dirt off a wound with soap, it just reveals the underlying problem below. Patients often wonder, and they ask me, after all that, why don't I feel any better, or why did I bother with that at all if it didn't cure me? So just like in our dirt analogy, until the crud is cleared away, real healing cannot take place as the pathogenic factors keep our wounds open and fresh. Eventually that wound can spread and cause more problems. So once this step is complete, it brings us to point number 9. Common mistake number 9 is failing to enter the repair stage. This repair stage should follow the clearing away of the pathogenic factor stage. So it typically lasts much longer and the improvements are more subtle and slow in many people. The hardest part of this can be staying the course over the next 3 months, typically to a year. So many patients figure that after they've finished clearing away any pathogenic factors in their body, they should now be good, and their symptoms should be completely gone. This is rarely actually the case, although it can happen. If the repair stage is not well adhered to, patients are much more likely to relapse. So this stage requires the most customized treatment plans that take into account various underlying imbalances and disorders. The 10th and final mistake that we see quite often is thinking that professional assistance will cost more. Professional support often costs less, not more, for the treatment of complicated conditions in the long run. Now, don't get me wrong, I'm not against people treating themselves. I do my best to put out as much information as I can, and I support the free use of herbal medicine by everyone. Nevertheless, professional assistance means only ordering the lab tests that you potentially need. It's getting access to the highest quality of supplements and herbs. It's choosing the treatment that is most likely to be successful and having someone to walk you through the repair stage. Okay, the sheer number of companies selling supplements and herbs directly to consumers that have like almost zero value is astounding. I mean, we hear this all the time among other professionals, oh, the patient took XYZ herb for 6 months with nothing, and we check what they're taking. They're taking grocery store brand herbs, okay? This is something to be avoided. So I hope in listening to this, or if you're reading this on our blog, you can identify some of the areas where you're failing and falling into these common pitfalls and do a little course correction. All in all, here's a summary of our talk. It's a little difficult to summarize this all down into a couple of points, but here we go. A clear diagnosis is important in choosing the most appropriate treatment plan. Treatment plans should take the individual's unique health situation into consideration. Treatment plans should be adjusted when results are not being achieved. The repair stage is almost as important as the pathogenic removal stage, and I would say actually could be even more important. Consider professional assistance, especially when being faced with multiple underlying health conditions or you have been resistant to treatment. Now, I'm Eric Vanderwall from GutWellNow.com. That's GutWellNow.com. We specialize in the treatment of gastrointestinal disorders using traditional Chinese medicine and functional medicine. If you'd like to contact us, we do online consultations for these types of conditions. So go ahead, jump over to our website or send us an email and we'll respond back to you as soon as we possibly can.